Hello everyone, it's Amanda Stott and welcome to another in our series of NRS 123 lectures. The topic for this week is safety and quality in clinical practice. The learning outcomes for this week include understanding what the clinical incident is, most importantly the factors that can lead to clinical incidents occurring at work, and it's also important that you have an understanding of the reporting process and how to respond professionally when a mistake is made at work. So let's just give a little bit of background. Just like everyone else, nurses sometimes make mistakes that can result in harm to others. And the Nursing and Midwives Board of Australia, in their professional documentation or their codes of standards for practice, you'll be familiar now with your code of conduct and your code of ethics. They actually articulate and make a number of statements with regard to safe conduct, both in your workplace and towards our patients. For example, the Code of Professional Conduct for Nurses in Australia, in Conduct Statement 1, it states that nurses practice in a safe and competent manner. Number 2, nurses practice in accordance with the standards of the profession and broader health system. And number 3, nurses practice and conduct themselves in accordance with laws relevant to the profession and practice of nursing. So obviously in the area of work health and safety, you'll know that the Work Health and Safety Act is one of the legislative frameworks that guide our practice for this area, and we'll be looking at that when we look at areas in the module to do with work health and safety. So as well as your code of conduct, which is very clear on highlighting the importance of recognising patient safety, and it's a very important part of our everyday nursing work. The Code of Ethics also refers to safe conduct. For example, in Value Statement 1, nurses value quality nursing care for all people. And number 6, nurses value a culture of safety in nursing and healthcare. So I've just highlighted some of the professional practice standards that are there on the Nurses and Midwives Board of Australia. So you should recognise that these are very important documents, and you know the whole issue of safety in the workplace, whether it's safety for your colleagues, towards your patients, maintaining safe systems of work, responding appropriately, recognising how mistakes are made is a very integral part of what we do on a day-to-day basis. So let's just look at this important key term that you must understand. And the chapter reading that you've been given in this module, it's chapter 10 from the text Atkins, and the link is in your module, and it's well worth reading. It's a very good chapter from that text, hence why I've included it. And that clearly outlines all of the systems to do with witnessing and making mistakes. We'll cover some in the tutorial, but again, it's a very good additional section of reading, and it does cover the clinical incident. I've given you there on the PowerPoint slide the definition of what a clinical incident is and the certain categories. So the clinical incident need not be a dramatic event. Usually it's an incident which has significance for you. It's often an event which made you stop and think, or one that's raised questions for you. It could be something to do with an interaction with a patient that's caused you to question an aspect of your values, your attitude, or your behaviour. It's an incident which in some way has had a significant impact on your personal and professional learning. To give you an example, in the university setting, a critical incident might include, an aspect of your work that went particularly well, or it could be, if you're doing group work, something that proved very difficult, a piece of work that you found particularly demanding. It might have been an incident with another student or a lecturer that involved conflict or hostility, aggression or criticism. So, that's it from the university domain. But in a clinical setting, a critical incident might include, for example, a medical emergency. It might be an unusual condition or a difficult situation. Some examples might be a communication problem. For example, you're interacting therapeutically with a patient from a non-English speaking background. It might, having done consent, it might be in something relation to a miscommunication. It could be something to do with that. It could be an interaction with a patient which has made an impression on you. It could be, it's not always negative. It could be a positive one. It could be an incident that made you feel inadequate, and perhaps it's something to do with your skill level, working outside your scope of practice. It could be a time when you felt confronted, or it might be an incident which made you think differently or caused you to question your assumptions or beliefs. So it's a very, very broad-ranging term, but suffice to say, I think wholly and solely from the clinical environment, a lot of it does come down to when errors occur. But remembering that, don't look at them just so narrowly, but they generally relate to issues of communication, whether there might be a knowledge deficit. It could be a treatment issue. It could be an issue to do with culture, interacting with a patient, relationships, the boundaries of professional practice. Remember, we covered that back in week 2, and so on. But certainly a clinical incident can be described as any unplanned event which has the potential to harm a patient or colleague or yourself. So it can range from actual physical harm, psychological harm, remembering the range of harm there. It's not just one physical harm. People can be hurt psychologically, for example, breach of confidence and so on. Errors or clinical errors, if you like, or mistakes also range in their complexity and their degree of harm. So, to give you some examples, a clinical error might be failure of a clinician to follow policy standards, and many of the cases that we've been looking at throughout our modules to date have resulted in or been underpinning that has been failure of a clinician or a nurse to follow due process in terms of their policy standards, whether it's medication administration, not documenting properly, and so on. It could be something like doing a dressing 3 times daily instead of daily. Okay, fairly minor, but at the same time it is a clinical error. It could be giving the wrong medication. And that can range from something that does not harm the patient to something that is catastrophic, or what we might call a sentinel event, which results in the death of a patient. So, system errors. There's other types of errors. So we've got individual errors and there are system errors. For example, there might be a failure in a management system within the institution that contributes to the error being made. There might be a breakdown in a system of the way that electronic healthcare records are protected, and so on. So they do range from the minor, failing to administer a medication, to complex, which are really systemic problems within a workplace or culture, but nonetheless, all contribute to mistakes or errors occurring. So as I've explained, a sentinel event, you might come across in the literature that terminology, that is usually a catastrophic outcome in terms of harm towards a patient. And a good example of that would be when the wrong medication is given to a patient and it results in their death. Another example might be failure to detect a deteriorating patient, would be a sentinel event. A suspected suicide of a patient in an inpatient unit, retained instruments after surgery, maternal death associated with labour, they're all examples of a sentinel event. So just to present an overview there, the clinical incident can range from the very minor to the complex, and again can result in anything that has the potential to result in a near miss, for example, to the actual harm of a patient.